Hello, Healing Spot community. This is Justine Calderwood with the Healing Spot Physical Therapy. I am a physical therapist. I specialize in treating women with chronic pain, basically of the head, spine, and pelvis and hips, as well as pregnant and postpartum moms. So today we're talking about what is pelvic organ prolapse and how do I know if I have it. So this is something that I regularly treat in my practice, so I wanted to give some information on this because I bet there's quite a few more women that are suffering from this and don't really know what's going on. So what is pelvic organ prolapse? So I have the female pelvis here, so you can see it just making the bony ring here. This is the spine. It would be stacked up this way. So as you're standing, it would look something like this, okay? So as you're standing at the pubic bone, it creates a shelf for some organs that you have in your pelvic cavity. So when you have a prolapse, basically what it means is that the organs inside the pelvic cavity can actually descend down into the vaginal vault, and they can even actually extend outside of the body, okay? So what organs are they? So moving from front to back, the organs that we're looking at here right behind the pubic bone is the bladder, okay? So that's one of the organs that can prolapse and actually descend down. Attached to the bladder basically is a urethra, so it's not really shown very well on here, but that, the urethra is the tissue as it comes out. That's where urine comes out. So that can also prolapse as well. The uterus, so you see the uterus here, fallopian tubes coming up. The cervix is the opening of the uterus. So the uterus can actually descend down into the vaginal vault. And then back behind here is the rectum. Okay, so that's front to back. So any of those organs can actually descend down. And I won't go over the grading system, but there's different grades depending on how low those organs have prolapse. But like I said, any of them can actually extend outside of a woman's body. Okay, so I did a little research, and basically it said that about 20% or 1 in 5 women in the United States are suffering from pelvic organ prolapse. So you can get any of these organs to prolapse, and it can be a combination of all 4. Okay, so how would you know if you have a pelvic organ prolapse? So we can go based on symptomology. So some of the symptoms that you may be experiencing is feeling like a heaviness, a pressure, or even a fullness in the vaginal area. Feeling like your organs are going to fall out or slip out of you especially when you're upright, so when you're standing or sitting. I've actually had women that will wear a pad because they feel like that gives them a little extra pressure into the vaginal area, so they feel a little more secure, okay? Having a backache low in your back, having pain with sexual intercourse, leaking urine or feces, okay? So having just leaking feces or having like fecal smearing, urinary stress or urge incontinence, so actually having accidental loss of feces or urine, chronic urge to urinate, chronic constipation, okay? And then also having to splint your rectum, so like putting pressure along the backside of into your buttocks or close to the rectum when you're having to have a bowel movement. So hi Marcy, it's good to see you. All right, so those are some of the symptoms, okay? So you can go based on symptoms, and I want to talk a little bit about what causes pelvic organ prolapse. So the number one reason is because of pregnancy, labor, and delivery, because of all the strain that happens, the stretching of the pelvic area and the pelvic floor muscles. Pelvic floor muscles, they create, I'm going to take these organs out and just kind of show you from the top. As you're looking down in there, do you see that kind of basket or sling of muscles? Those are your pelvic floor muscles. And then as I turn this over, you can see the vaginal opening here, the anus there, and then again, these pelvic floor muscles, they create kind of like a basket. So I tell moms, you had this strain and, you had a baby, especially you had a vaginal delivery, or even if you've had a C-section, but you went through part of labor where baby, came down and, those later stages of pregnancy or of labor, even if you, had a C-section, you might have had some strain to the pelvic floor muscles. But it's kind of like, think of the bottom of a basket, and if that is weak and you're holding a container of liquid or whatever and you have some kind of strain, coughing, sneezing, that kind of thing, and the basket isn't strong on the bottom, it's going to give, right? So think of it that way. Another reason that this may happen is because of obesity. So basically any kind of upward pressure pushing down into this area. Chronic respiratory conditions, so chronic like coughing, again, increasing intra-abdominal pressure and putting pressure into those organs. The constipation, basically straining through the pelvic floor muscles when you're having a bowel movement or even when you're urinating. So some people, actually push quite a bit even when they're urinating. And so you want to keep those pelvic floor muscles relaxed, okay? Using something like a squatty potty is a good tip so that your pelvic floor can actually be a little more relaxed when you're going to the bathroom. Pelvic cancers can cause some pelvic organ prolapse, history of hysterectomy, as well as let's see, anything that increases the intra-abdominal pressure. So I have, you don't necessarily have to be a mom, okay? I've seen women that have never had kids and they have pelvic organ prolapse because of imbalances between the inner core muscles and the outer core muscles. We're taught, you should have a strong core, but there's actually the inner core muscles are the stabilizing muscles, and they help to create stability, okay, around the abdomen. So you have, from the front side, you have the transverse abdominis, low abdomen. From the bottom, you have your pelvic floor muscles. From the back side, the multifidi muscles are the stabilizers. And then you also have your diaphragm, okay? So they help to create kind of this canister. But if your oblique muscles and the rectus abdominis, so the rectus muscles are here and the oblique muscles help you to turn your trunk, those are more of the mover muscles. And when those muscles are stronger in relation to the inner core muscles, they do a lousy job at stabilizing, okay? And so when they take over, it can actually increase pressure into this, like the lower abdomen and the pelvis, and it can create that downward pressure that we don't want. It can set you up for pelvic organ prolapse. So, so having that good balance between the inner and outer core is important. So going based on symptoms, history, these are things that we put together. But how can you, if you're at home, how can you do a self-check for checking for a prolapse? So I'm going to walk you through that. I'm not going to actually show you that, obviously, but I'm going to talk to you about that. So what you can do is you can sit in a semi-reclined position. So this works out really well if you if you're in your bathtub or even resting up maybe against the headboard of your head. You want to be semi-reclined, so get some pillows back behind you. And then I'm going to move this camera just a little bit as I talk. So what you can do is, you're going to be you're going to be reclined, and then your legs are going to be out, knees apart, and you can actually take a pillow on either side, so that way your legs can be relaxed, okay, and supported. And then what you can do is actually get a mirror. So you're going to be, you're not going to have your clothes on with this, obviously. So you're going to get a mirror so that you can take a look at things, okay? And you're just going to put that down below between your legs so that you can take a look. And, I realize with this, depending on your what you were taught, culturally or in your family or that kind of thing, I realize it's hard for some women to look at themselves, okay, and to touch themselves. We're told not to do that, or you might have been told that. So this is, this is obviously going to be something that you're going to have to decide if you could do this for yourself. You can go to see somebody as well, which we'll talk about. But, part of that too is it's okay to check your own body. It's okay to feel comfortable looking and touching your own body, especially for this type of assessment. So I encourage you to just kind of sit, if those feelings come up and you feel shame, or if you feel embarrassed or like you're doing something wrong, just let those feelings come up, okay? Because that's part of what's stuck in your pelvic floor muscles, okay? So what you're gonna do then is I'm gonna walk you through based on this model, but so you would be here, and the vaginal opening is gonna be on the top, okay, closer to the ceiling. The rectum is going to be on the bottom. So what you're going to do is you're just going to open up the labia or the vaginal lips, and you're going to just separate them, and you're going to look, okay? So you're going to see the opening of the vagina, and you're going to then do some kind of strain, like cough. Sometimes people get embarrassed, like when I do assessments with them, and they'll laugh because they're embarrassed, and that might happen to you. But that increases the abdominal pressure, and what you're looking for is any kind of bulge. So you want to see any kind of pink tissue that might be be moving and coming out, or coming to that entrance, or even extending outside your body. Okay, so that's again, without going into the different levels, that's a good quick way that you can check. So reclined is a good position, but most people, when they have symptoms with prolapse, it's usually in gravity. Okay, so you want to also check with you standing. So a good way to do that would just be to get a stool, and you can put one leg up. Again, you're going to use the mirror, open the vaginal lips, and you're going to then cough, laugh, that kind of thing. Okay, so you're just checking for a bulge. And I'm going to share, there's a physical therapist that does a great job. She took some great pictures, kind of walking us through, not an actual exam, but she illustrates it in a good way using the model. So I'm going to share that tomorrow, because I just think she did a wonderful job explaining kind of step by step. Okay, so what if that's a good quick check at home. Okay, and if you see something, so sometimes I have people where they're concerned that they think they have a prolapse, and they come in and I'm checking that, and what they actually have is maybe a little extra tissue, and so the labia has torn a little bit, or there's some scar tissue along the perineum, so they're concerned about things like that, thinking it's a prolapse. So it is a good idea to take the guesswork out and see a pelvic floor physical therapist, because these are assessments that we do quite frequently, and we can give you an idea. We're really set up to check the muscle strength and the function, and so seeing a pelvic floor physical therapist, a women's health PT, I highly recommend that. It's going to take the guesswork out of it, but at least this gets you started, and you can decide, hey, there's something going on here. I'm not sure exactly what, but I do see a bulge of some kind. That just indicates that you should get it checked out and get it looked at. Okay, this is it's something that can be treated. Okay, it doesn't require surgery. I mean, I would say the first thing that you should do is some conservative management, like physical therapy, and trying some exercise and education. Okay, bringing balance back to the whole abdomen and the core, and then also getting some internal work done as well. There's a lot that we can do externally around the pelvis and bringing balance back, but it's within our scope of practice to do intravaginal work as well, and so that's something when I check with my moms or non-moms, women, I check first with them lying down, and we're looking at that, but then I actually have them stand up and I check as well. So I go into the vaginal opening and I'm checking, where is that bladder, where is the uterus, where is the rectum, and I'll have them do some type of strain. So usually cough is an easy one to increase the pressure into the abdomen. But sometimes I have people maybe that didn't change a whole lot, so I might have them do a simple squat, or even reach down and pick up something off the floor. Okay, and that kind of comes with I ask the person, well, when is it bothering you? And that helps me to decide when or what kind of test to do. Okay. So, and I reassure you that anything that I do with a patient, any kind of treatment and assessment, I have been a patient myself, okay? To learn this type of work, I've had to not only perform it as a therapist, but I've had to receive the work. So I completely understand, the shame and, sometimes the uncomfortable feeling that can happen. But I will also reassure you that this is a lot more comfortable than a well woman exam, because we're just using a gloved finger basically to assess. So, all right. If you have any questions, please ask them now, and I will do my best to answer them. I do appreciate you guys coming on and listening. Hopefully this has been informational and it's helped somebody. Please share it if you have a friend that you feel like would benefit from this information, because women talk, especially with your best friends. You might know of somebody that really needs this help and they don't know where to turn, okay? Or they feel like their only hope is to have surgery and they know they don't want to do that. So again, conservative management first. One of the things that I do is just getting these organs, and we're pulling them back up, not pulling them, but we're kind of helping guide them back up onto the shelf. So as you're standing, again, this pubic symphysis should make a shelf for the pelvic organs to be on. And so if they're down, I will just very gently help them to come back up. Okay, so hi there. So Siobhan is talking about or asking about prolapse during pregnancy. Is there any advice? Does it get better or worse throughout, typically? Advice for after delivery. So, you know, as baby grows and as that pressure increases in the abdomen, potentially it could get worse. But, you know, this is where, you know, going over things like doing those Kegels and strengthening the pelvic floor muscles in optimal position. So I'll go over even, you know, posture things, because depending on how you're doing your pelvic floor strengthening, if you're not in the right posture and the pelvis is off, that's going to affect how well you can strengthen those muscles, okay? And then I like to work on engaging the transverse abdominis and with coupling that with the breath, okay? So on the inhale, I'm just gonna kind of use this, like your diaphragm and your pelvic diaphragm sit like this. So on the inhale, as you inhale, the diaphragm moves down, okay? And the pelvic floor muscles should be relaxed, okay? When I say relaxed, I don't mean you're bearing down. Okay, you're not pushing out, you're not straining. They should be relaxed. And then on the exhale is when you should contract the muscles, contract the Kegel, okay? And the diaphragm is naturally gonna move up, okay? So I work on with my moms, you know, actually being able to contract on the exhale and relax on the inhale, okay? So that's one thing. And then also coupling the pelvic floor muscle contractions with the transverse abdominis. I've had women be able to contract the transverse abdominis, but they're completely unaware of their pelvic floor muscles. And that's going to increase some of that pressure. So making sure that the proper muscles are firing with the diaphragmatic breathing. You know, one thing with pregnancy, as baby grows, we'll get this kind of rib thrust where the thoracic spine will extend. And so that's something that can be worked on during pregnancy as well, is helping to release the psoas from the backside and helping that rib cage still be able to expand in an optimal position. So there's quite a bit that can be done. I don't do pelvic floor internal work in the first trimester, and we don't even in the later stages in the third trimester. So, you know, there is a window of time during the middle that we can do some internal pelvic floor work and internal assessment. I also like to do some energetic work and just working on the pelvic floor. Siobhan, I know that you are familiar with Tammy Lynn Kent's work, and so I even like to do some pelvic mapping with my moms, so we can really find out what part of the pelvic floor needs a little bit of loving, okay? So hopefully that helps. Advice for after delivery, get it checked out, okay? Wait your 6 weeks or whatever, let things heal, especially if you have any perineal tearing. One thing, I didn't mention this, but I'll actually check for pelvic or trigger points in the pelvic floor, and even I'll do any kind of scar release along this perineum, okay? Because, you know, you can see these anal sphincter muscles, they wrap around and they come up, okay? And so if you've had an episiotomy or if you've had any kind of tearing in this perineal area, I'll work on that. So I'll have one finger just right inside the vaginal opening and kind of do some release along the anal sphincter, okay? Because if that's tight and it's not functioning, guess what? You can't get a good lift up in the pelvic floor muscles. So yeah, I mean, I could go on about what can be done postpartum. So do you have any other questions there? Yeah, okay. Hopefully that helps. Siobhan, if you want, you can reach out to me, and I know that you're in Canada, and I would love it if we could get you connected with somebody that does some of this work too. So, all right, guys, that's all I have for you today. If you have any additional questions, or if you, like I said, if you want to take the guesswork out of this, reach out to me, especially if you're local. If not, I'll help you get in touch with somebody that is in your area. I'm plugged into several different pelvic floor and women's health groups, so I'd be happy to direct you in the right direction to find you the help that you need. So, all right, great. I'm glad that helped. We'll see you guys next week. And thank you. I was going to say thanks for being patient. I know I was a couple hours late. My kids, I had to go and pick them up from school. They both had sore throats and all this stuff. So that's a mom life, right? All right. Have a great week, you guys.